HCPCS Questions and Answers 2026 with explanations. 25 Most Common Questions. Question 1. HCPCS Level II codes are primarily used for which of the following? Inpatient procedures, supplies, equipment, and drugs not in CPT physician office visits, laboratory tests only. HCPCS Level II covers DME, prosthetics, orthotics, and supplies. Question 2. Which letter prefix is used for J codes, which represent injectable drugs? A, D, J, L. J codes are for drugs administered other than oral method. Question 3. What does the code J0162 represent in the 2026 update? Injection, epinephrine, Fresenius, 0.1 mg injection, penicillin, oral aspirin, wound dressing. J0162 is a 2026 update for epinephrine, Fresenius, 0.1 mg. Question 4. Which HCPCS modifier indicates right side? LT-RT 50, E1. RT stands for right side, LT stands for left side. Question 5. Code E0601 is commonly used for what piece of equipment? Wheelchair, CPAP machine, hospital bed, oxygen concentrator. E0601 is the code for continuous positive airway pressure, CPAP, devices. Question 6. Which code range is used for durable medical equipment, DME? A0000, A0999, E0101, E9999, J0000, J9999, L0000, L9999. E-codes are used for durable medical equipment. Question 7. The modifier RR stands for what? Rental, repair, replacement, right side. RR is used to indicate the rental of DME. Question 8. Which HCPCS Level II code is used for a standard wheelchair? K0001, E0101, J0101, L0101. K0001 is the code for a standard manual wheelchair. Question 9. New 2026 code J0654 represents which medication? Injection, liothyronine, 1 mg. Injection, insulin. Injection, morphine. Injection, heparin. J0654 is a new code for liothyronine, 1 mg. Question 10. HCPCS stands for what? Healthcare Common Procedure Coding System, Hospital Common Patient Coding System, Healthcare Professional Coding Standard, Human Care Patient Coding System. Healthcare Common Procedure Coding System. Question 11. Which modifier is used to indicate that a service was provided via telehealth? 95, GT, GQ, all of the above. Modifiers like 95, GT, and GQ can be used depending on the payer and service. Question 12. Who maintains the HCPCS Level II code set? AMA, CMS, WHO, the Joint Commission. CMS, Centers for Medicare and Medicaid Services, maintains Level II. Question 13. What type of code is used for ambulance services? A codes, B codes, C codes, D codes. A codes cover transportation, ambulance, and various supplies. Question 14. The modifier new stands for what? New equipment, nurse practitioner, not used, never needed. New is used when DME is purchased as new. Question 15. Which code range is used for orthotic and prosthetic procedures? E codes. L codes, J codes, V codes. L codes are used for orthotics and prosthetics. Question 16. Which code would be used for a flu vaccine? J0000, Q2037, or similar Q codes? E0001, A0001. Q codes are often used for temporary codes, including some vaccines. Question 17. Code J1736 in 2026 represents which drug? Injection, meloxicam, 1 mg injection, valproate. Injection, vancomycin. Injection, epinephrine. J1736 is the 2026 code for meloxicam, Dileva, 1 mg. Question 18. What is the purpose of HCPCS Level II modifiers? To change the meaning of the code. To provide additional information about the service or item. To increase the payment automatically. To replace the code. Modifiers provide extra detail, example anatomical site, rental versus purchase. Question 19. Which code is used for glucose test strips? A4253, E0607, J1000, L1000. A4253 is the code for blood glucose test strips. Question 20. How often are HCPCS Level II codes updated? Every 10 years. Quarterly and annually. Only when the president changes. Every 5 years. CMS updates HCPCS Level II on a quarterly and annual basis.